Make no mistake, this is a direct attack on Roe v. Wade. It is a bill that is a response to right-wing radio hosts and columnists, and frankly, women's health is an afterthought in this bill.
Republicans clearly didn't learn anything from the 2012 election, when voters rejected their war on women and asked us to focus on making their lives better. Americans want us to go back to work, not to go back to the last century.
The 20-week ban on abortions is yet another example of attacks on women, on women's health, on women's choice.
It's about interference in one of the most important relationships that has to be protected, the relationship between a doctor and a patient. We're not here to tell any patient or any doctor what is appropriate in terms of health care.
Women should not have to rely on last-minute court decisions to be able to make the best health care decisions for themselves and their families. And I want to make one thing clear. These bills, from Wisconsin to Washington, D.C., are not about allowing women to make informed choices. They are about attacking basic American freedoms.
Bills like the one Senator Rubio may introduce aren't really about the very rare cases where abortion happens late in pregnancy. They're part of a coordinated strategy by politicians and groups across the country who want to end safe and legal abortion entirely.
As physicians, my colleagues and I are responsible for delivering the highest quality medical care to our patients. This legislation interferes with my ability to care for my patients.
We are not going back, not to the 1950s, where the Republican rhetoric on this issue seems to be stuck, or to 1973, when this issue was decided. We're not going back on settled law. This bill, like attacks on Roe v. Wade before it, will eventually be lost to history. But I can assure you it won't soon be forgotten by millions of American women.